Katie Phang with the Contrarian. I'm sitting down with Congressman Ritchie Torres. We're talking about the GOP budget bill and the impact it's going to have on all Americans. We are grateful that he's able to join us now. Congressman, thank you for taking the time. Look, I just got to start straight out of the gate and ask you your thoughts about the fact that the GOP budget bill, which, by the way, is a betrayal of the American people, so calling it a budget bill really should be called a budget betrayal. Your thoughts about the fact that we had some Republicans that decided to vote present last night in order to get it out of that committee?
Well, a present vote is effectively a yes vote. I mean, you're aiding and abetting an unprecedented assault on Medicaid, on SNAP, on all these programs on which tens of millions of Americans depend. There's no congressional district that has a greater stake in what is happening than mine.
Yes.
67% of my district is enrolled in Medicaid. So more than 50% of children, more than 70% of children, more than 80% of nursing home residents, more than 90% of baby deliveries are all covered by Medicaid in my congressional district, which happens to be the poorest in the country. And so here you have Republicans who are defunding healthcare and food in the tune of about $1 trillion in order to fund more than $1 trillion in tax cuts, not for working people, but for the top 1%. And keep in mind, the top 1% has 10 times more wealth than the bottom 50%, which consists of 65 million households. And so Republicans are going to defund healthcare and food and education for the bottom 50% in order to provide massive tax cuts for the top 1%. To me, that is just a misplacement of priorities.
And Congressman, the one thing that I really want to emphasize here is the following. A lot of people seem to have this misconception about the word Medicaid. Okay. A lot of people seem to think that Medicaid doesn't impact me in some way or doesn't, have an effect on my community, because a lot of people seem to think that it's just limited by a definition of having to hit certain income levels to qualify. But you just reeled off a number of people that are impacted by these Medicaid cuts. And it's not just people that may be at a certain income level.
So there are 70 to 80 million people who directly receive Medicaid. And then when you add in the CHIP program, it's 80 to 90 million people. And then just about every hospital in America depends heavily on Medicaid, and the healthcare sector is nearly 20% of the US economy. And in most rural or urban counties in America, the largest employer tends to be the healthcare provider, the local hospital, which is heavily dependent on Medicaid. So just about every American, either directly or indirectly, is affected by Medicaid. And there's this false narrative that there are quote unquote undeserving poor people who are gaming the system, and it's full of fraud and waste. And keep in mind that Medicaid is every bit as vital to the elderly as Medicare. So in New York State, the elderly and the disabled make up 20% of the Medicaid enrollees, but 60% of the Medicaid expenses. Right? In New York State, when it comes to children, the Medicaid program spends about $3,200 per beneficiary. For adults, it's $5,900. For the elderly, it's $32,000 per beneficiary. For the disabled, it's $35,000. And so Medicaid is not only health insurance for the lowest income, it has become long-term care for the chronically ill, the elderly, the disabled, the most vulnerable people in our society. So make no mistake, these cuts against Medicaid is not an attack on fraud, waste, and abuse. It's an attack on the most vulnerable people in our society, including the elderly.
And I think a component of this that seems to get lost when the GOP talks about these proposed tax cuts is the reality, which is Republican constituents. It's not just Democrats that are being impacted by this. Republican constituents, they're also Americans, and they're also going to be impacted by these Medicaid cuts. Why is it's so difficult for the clarity of that message, of the reality of the numbers that you have just shared with the people that are tuning in? Why is it so difficult for that message to be heard across the aisle when it comes to Republican voters?
Well, it's not just Medicaid. The benefits of the Inflation Reduction Act are overwhelmingly flowing into red states. I remember the Financial Times did an analysis of more than 100 announced projects within the first year of the IRA's passage, and it found nearly $200 billion worth of announced projects in Republican-held congressional districts versus less than 20 billion in Democratic-held congressional districts. Of the 20 congressional districts receiving the most IRA investment, 19 of them are Republican districts. So these laws disproportionately benefit rural states and counties and red states. And so Republicans are sabotaging the interest of their own constituents.
You know, we say sometimes tongue in cheek, and yet it's really not. We say this is the find out part sometimes for some people who realize the foolhardiness of their vote and the waste that it was to be able to put somebody like Donald Trump back into office, having not learned their lesson the first time around. But we don't want to see fellow Americans suffer. So, what are the available options then? We're at this point where you had those present votes, which you're right, those are tantamount to yes votes. They got it out of committee. What do you think are the viable prospects for the GOP budget bill once it actually is considered by the full, House and the Senate? I mean, your thoughts about whether or not you think it's actually going to get across the finish line?
It's hard to know for sure, but we have to put extraordinary pressure on the so-called moderate Republicans who are in congressional districts held by Biden and who are in states that depend heavily on Medicaid. I mean, those Republicans are the key to defeating a reconciliation bill that would defund healthcare for the elderly and the most vulnerable in our society. So that's where our focus should be. And then the Senate, we have to put pressure on the Senate to remove these cuts to Medicaid, to remove the cuts to SNAP, to remove the repeal of the IRA. It's disgraceful.
I have a lot of people on social media and other platforms that ask congressmen all the time, what can we do just as an American, just as somebody who cares about what happens as this country moves forward? What can we do to be able to have our voices heard? Is it effective? Have you seen it being effective to literally just pick up the phone and call your representative in Congress and express your opinion about this bill?
Nothing's more powerful for a member of Congress than hearing directly from our constituents. Like, tell your story. One of my concerns is when we're discussing reconciliation bills and budget bills, it becomes too abstract. It becomes about dollars and cents. But ultimately, this debate is about lives and livelihoods. And I find myself deeply moved by the stories that I've heard. I spoke to a woman by the name of Phyllis Lombardi,
Mm.
who has a son with severe autism. And she spent all of her retirement funds and she sold her home so that she could get health care for her son who has severe autism. And when he finally qualified for Medicaid, it was a game changer. Like, she would have been bankrupt were it not for Medicaid. And I asked her, how much would the therapy have cost without Medicaid? She said it's $16,000 a month.
Oh my gosh.
Who can afford $16,000 a month? I'm not aware of a working person in America who could afford $16,000 a month. For me, the basic promise of America is that if you work hard and you play by the rules, then you should have access to a decent life. And Republicans are robbing tens of millions of Americans of their fighting chance at a decent life.
I've been saying that Donald Trump is doing Robin Hood in reverse. The disparity between the haves and the have-nots has grown to be just so painfully profound. And yet, all I am seeing right now when I look at coverage, especially in mainstream media, I'm seeing attacks on Joe Biden, even after the sadness of the diagnosis that was announced for him yesterday. I am seeing attacks on other Americans that happen to be Democrats, congressmen, that are trying to expose the truth behind these budget bills. I kind of just want to ask you just kind of a higher level, just more maybe philosophical question. Do you share some optimism that the Democratic Party, can unite and kind of give and galvanize an energy and a positivity so that people can turn the corner on this because we truly are very fractured right now politically?
Look, the Democratic Party is a widely varied coalition that ranges from the Squad to the Blue Dogs. But the one thing that unites us is defending the social safety net, the social contract. that's supposed to lift up every American. Right? We think of America as a rising tide that's supposed to lift up all boats,
Yes.
from including the least among us. And that's the animating principle that defines us as Democrats. And I'm proud to see that every one of my colleagues has been standing firmly for that principle and resisting the abuses of Donald Trump and congressional Republicans. So I'm hopeful that the long arc of history will bend toward justice, and that we're going to see a Democratic House come 2027.
Well, I want to say thank you for taking the time to join us today. I appreciate it. And, you've always been so keen on transparency. So, Congressman, I appreciate that. You're always available to be able to speak to not only your constituents, but to the American public. And at a time when that's what we need the most in DC, that's something that you should be lauded for. So, thanks again for sharing this information and making sure that we're all better off.
Always great to see you. Take care.
Thanks a lot.